Very good afternoon. This is Dr. Karthikeyan, cardiac radiologist from the World Congress of Cardiac Imaging and Clinical Cardiology. It's a wonderful gathering where a lot of practitioners of different modalities of cardiology, cardiac surgeons, cardiac imagers, interventional cardiologists, and it is like a multidisciplinary meeting which is happening for over 3 days. So my role as a cardiac imager today, I spoke on the role of coronary CT, which is otherwise called as cardiac CT angiogram in patients presenting with chest pain. As many of you know and many of you would have heard, coronary CT angiogram is a CT scan of the heart where we do your risk assessment. If you have a family history or you have risk factors or you have a atypical chest pain but you are not diagnosed with an acute myocardial event. So you want to check if something is wrong with your coronary arteries in a non-invasive way, then we will recommend cardiac CT. So it's a simple day care procedure like any other CT scan. So where we inject a dye and we look at the coronary arteries. What we look at is what we called as plaques. In colloquially we call it as cholesterol deposition. So there are many different types of plaques, and currently what CT helps us is pick up plaques which are called as high risk plaques which could cause a cardiac event, or these are plaques which at some point of time can suddenly decide to rupture and cause a heart attack. So there are many different varieties of plaques which we pick up using CT, and today's my talk was to elucidate on how we differentiate the plaque and to pick up plaques which are at risk of ruptures. And as all of us know, chest pain can be caused by other things also. It need not necessarily be because of coronary artery disease or heart attack. It can be because of an aortic disease like an aortic dissection which can happen in the aorta, or it can be a thrombus within the pulmonary artery, or it could be inflammation of the pericardium. So a lot of deliberations are happening both on the treatment side, on the imaging side, and in the future today and for the next 3 days. Thank you.